Hi, good evening, ladies and gentlemen. You are here with Channel 52. I'm your host, Amber Huck, and today we are going to be talking about maternal health and delivery during COVID. And I have a panel of very important and beautiful ladies here. We're going to be covering from all different directions. We're going to be covering parents who have been pregnant, a mom who recently gave birth, and we have a medical doctor with us, and then we have a natural remedy and another way of covering. We have a doula, which carries a lot of hats around her. So thank you, ladies, for joining us today. So I'm going to start with Nadia Hussain. Nadia Hussain is the co-founder of Bounty Organization, and she also is Criminal Justice Campaign Director. So thank you, Nadia, for coming.
Thank you so much, Amber. And I'm the Maternal Justice Campaign Director at a wonderful organization called Moms Rising, which is a national advocacy organization for mothers and families. And in that role, in my day job, I actually do work on advocacy and policy for pregnant and birthing people, with a focus on racial justice and racial disparities in care and in health access. And through Rowdy, the Bangladeshi American Women's Development Initiative, we are a grassroots organization working to empower Bangladeshi women and girls in the Paterson, New Jersey area, but also we work with the Bangladeshi community throughout the state. And thank you, Amber, for the introduction. I gave birth during the COVID-19 crisis, actually right when things were getting very crazy. My son was born on March 15th, 2020. In Morristown, New Jersey. So I gave birth in the hospital, and that was right before everything really went into quarantine down. I can talk more about that later, Amber. I can talk about it now. I wasn't sure if you wanted me to go into it, but I know that this is a very challenging time for mothers. For me, things were, as I was giving birth around March 15th. My son was actually due March 21st, but he came a week early. But he was healthy. I was healthy. I didn't have any pre-existing conditions. Things were changing so drastically. Just the week before, I thought my mother and my sister would be able to join me in the delivery room. And I had a doula who was also supposed to come and give me support. And the week before I gave birth, I found out that they were really restricting the number of visitors who could accompany the birth because they wanted less people around because of the pandemic. And I will say I was very sad to find out my mom couldn't come. A lot of times in our Bangladeshi cultures, in different cultures, it's very important to have your village, your community with you. And my mom has always been a very big support for me, especially when it came to my own motherhood journey. She was there for my first son, who's 5 years old now. And she was a big part of my support in the delivery room. And unfortunately, she couldn't come. They didn't want any extra people. My sister's a physician, and she wanted to be there too for the birth, and she couldn't be there
Yeah.
as well.
So that shows the severity of how rules they are, going on, that they do not want anyone except the mom. And this is actually even recently going on. Yesterday, I met a family, and the mom was telling me that my daughter has gone yesterday, and they're not letting anyone in. So it's pretty serious. And when it comes to social, emotional aspects of the mother who's actually going through childbirth, is a huge deal. It's like a celebration in many different cultures. So I'm just going to go through introduction through everybody, and then we can take the conversation from everyone collectively. So thank you, Nadia. The next person is Dr. Anita Azam. She is the pediatric endocrinologist, and she's actually joining us from the other side of the country. She's coming from Montana. So thank you, Nadia. Thank you, sorry, Anita.
Hi, my name is Dr. Anita Azam, and I'm currently practicing in Billings, Montana at St. Vincent's. I previously was in Philadelphia, Pennsylvania for about 7 years at St. Christopher's. And thank you, Amber, for inviting me. I primarily deal with outpatient subspecialty medicine, so I hope I can answer some of your COVID medical questions, but that's all I have for now. I mainly deal with diabetes and growth disorders and hormonal dysfunction.
Okay. Thank you so much for giving your time to us today. So next person is actually Munawara Begum. She is actually pregnant and she's sharing her this beautiful time with us. She's also a executive board member of Bowdy organization, and at the same time she's studying. So Munawara, please tell us about you.
Good afternoon, everyone. Thank you, Amber and Channel 52 for arranging this beautiful talk. Uh, my name is Munwara. I'm currently doing Masters in Diplomacy and International Relations at Seton Hall University. I'm also a board member with Amber and Nadia. We are a group of incredible women. I really love to be a part of the Vaudi. And before moving to the US, I worked as a senior lecturer in English at Stanford University. I'm really excited to share my experience uh, with all of you, and especially thanks to Amber. She's an enthusiastic member in our group, and she always takes things so enthusiastically that her enthusiasm is so contagious. So when she asked me about that, I gladly accepted. Thank you.
Thank you for accepting it because today you have a very important role, being a pregnant mom, and is kind of a guest of honor kind of thing because we're talking about maternal health. And last not but the least, one of the most important factor that I'm trying to link today is due to COVID, it's kind of a blessing in disguise. And then we're going to be discussing more with Michelle, which is a owner and a childbirth educator and a doula. So thank you, Michelle, for coming, and please tell us about yourself.
Hi, Michelle Gabriel Caldwell here, and I am a childbirth educator and doula. And what I'm seeing here with COVID is that a lot of mothers are not getting the support that were expecting. So even as early as Nadia mentioned, when the situation first started, we were seen as essential members of the hospital staff for the first 2 weeks or so. There was a huge rally. We all got together to make that happen. And then as the numbers started to increase, doulas were no longer allowed, and the amount of visitors within that space were reduced significantly down to one. And in New York, as you know, it was actually just the mom that was allowed. So right now in New Jersey, we're still with one visitor, and we are just trying to do our best with virtual help and support for these moms. So this is a huge piece of advocacy for me, as well as all the other doulas in the state of New Jersey, and we're just trying to give as much information as we can to moms so they are empowered in that space. And thanks for having me today.
Yeah, and I actually want to talk about it because it's such an important thing that I know with the situation going on with COVID. And Nadia, you can speak about this. I know that you were personally sharing with us when your days were very close, and you've been very active as a mom, as a pregnant mom. I have seen you till the last day working, which is a good thing. But you had that anxiety that, oh my God, I'm going to be alone. I'm not even sure if my husband is going to be there. And she really was worried about Michelle, you not being there, which is psychologically such an important factor throughout 9 months she's been with you. And that taken away creates such an anxiety for her and you as well.
Well, actually, Michelle wasn't my doula, even though she's somebody who's been supporting me even postpartum with things like breastfeeding, right? Because there's what happens is when people think of birth, unless you're an expert or you're a mother who's gone through it, there's so much involved in it. It's not just the moment that you deliver your baby. It's the health before you become pregnant, when you're pregnant, after you give birth, the mental and emotional support, the things like nursing support, breastfeeding support. So Michelle has been helping me after. I actually had a different doula, another another doula who was going to come with me. But absolutely, I mean, when my doula, I didn't have her for the whole 9 months, and doulas can come in and support, at various times. But I was really looking forward to having somebody advocate for me. I mean, I'm always the advocate, as you said, Amber, but having someone advocate for me, especially when you're in a very vulnerable state, right? You're about to give birth. You're very vulnerable. Sometimes, even in the best of times, there can be a lot of fear and anxiety. And for me, I remember when, again, my water broke at home, and every birth is different. It was a very different birth than when my first son came. Going into the hospital.
Okay. We didn't know that. You missed that part.
Yeah, well, going through the pain. I mean, I will say, just in terms of the fear, when I walked into the entrance of the hospital with my husband, it was a special entrance for pregnant women. They didn't want you coming in where the COVID patients were coming in. A woman who worked at the hospital said, "Oh, do you want a wheelchair to go into the hospital?" And I was having my labor pains, right? I was already contracting really heavily. I was in so much pain and anxiety and confusion that I just started crying, because I was like, I don't even know if I want a wheelchair right now. I couldn't even make that decision of, do I want a wheelchair? Because I thought if my mom had been with me, she could have said, "Oh, yes, she needs a wheelchair." I just was so overwhelmed. And even going in, I just started crying, telling my husband, "I'm so scared because my mom's not here. How can I do this without my mom?" Right. So even then, and I did not have complications, right? I was pretty healthy going in, and I still had that fear.
Absolutely, you're right, because with that pain, and we loses our sense of direction and making decision powers. And in that time, because I was having a conversation with Michelle earlier, mothers are going after a long labor, at that moment have been asked that, what, you have to do C-section. You have to go, this childbirth is not possible. I'm speaking from my own experience. I have 3 kids. All 3 of them were C-section. The first one, was a first delivery, and it's a big child. But second time, I really tried hard. And I was 9.5 centimeters, but I was told that, 9.5 centimeters, you're too tired. We're going to go ahead and have C-section. And when I shared with Michelle, I always feel that, there is nothing more better than natural delivery, because God has created a human body in that way. And that work has been, women are giving birth from centuries and centuries. But I'm not saying that, I know, Anita, we have a physician here. There are some cases that you really do need to have, C-section. But we can make that lower, correct? I want to know from you guys, Michelle and Anita.
Mute myself? Okay.
Yeah.
All right. Absolutely. I mean, when I heard your story about being 9.5 centimeters and someone told you that that's enough, you were so close. You had half a centimeter to go, and goodness knows where the station was of the baby, how far up or how far down that baby was. For me to hear something like that, it just breaks my heart, because you naturally get adrenaline right at the pushing phase. And so even though you are spent and tired and everything to get to that 10 centimeters, you're going to get this boost of energy to push your baby out. So I'm really, really upset to hear that that's something that happened to you. And of course, like you said, there's definitely a need for medical intervention, because some moms do need it. But I think we err on the side of everybody needing intervention, as opposed to waiting to see whether or not that's the case, and giving people time to actually labor. And I don't know what the rush is. I don't know why we need to keep rushing people. So
Yes.
what I'm seeing is a resurgence of a movement back into natural birth, which is in natural physiologic birth, which is really kind of near and dear to my heart, of being the doula coordinator at a birth center in New Jersey. I'm seeing so many moms actually go into that space, as well as home births too, because they feel like, what, I'd rather do this without an epidural than catch COVID. So when you look at those priorities and how they're shifted, you actually have better outcomes and healthier outcomes.
Absolutely right. Anita, what's your feedback on this?
Cesarean sections or
Yeah, in general, at the last minute push, mothers push to have C-sections.
yeah. I mean, I really think that's between the patient and their provider. But like you said, I mean, I think that's really patient preference, and some mothers, obviously prefer to go the natural route, and that's totally understandable. But I think just making sure like there aren't any contraindications for a natural. I really think it's between the mother and her doctor.
Okay.
Yeah,
Well,
it should be a choice for her, right? I mean, it should be an option, and she should know all of her options.
yeah. Well, thank you for, I just want to read some comments. There's people who are acknowledging. It's Amir Hamza is saying to Dr. Anita, great to see you. Tanya Chaudhry, thanks for having this conversation. It's very important. And JMH, very important conversation. So people are agreeing there. I don't see a question yet coming up, but people are agreeing right now. If any question come up, I will. So I don't see a question coming up right now. So having said this, now my question comes to Mina. I know that you are a mom, which is how far are you pregnant?
So I have just started my trimester.
Oh, your second trimester?
Yeah, I have just started.
Okay, so it's good things gonna start happening. You're gonna start eating and all those stuff.
Yeah.
So now, as with the situation changing, and I know it's getting a little better, but on your mind, and what's your plans in terms of what's going to happen? Because it looks like by the time you're going to come, the curve is going to be changing again, and I want to hear from you.
Thank you, Amber. So, like pregnancy is a blessing, but it's always stressful. Like always, like you never know what's going to happen. Like there's so many questions, uncertainties always come and bother your head. But with this, like the COVID-19 situation, like, a new dimension has added, like a new challenge has added. So I am really excited about this baby. My daughter, she's now she'll be 2 years old next month. Actually, this month at the end of this month, and like she wants a baby, a baby brother or baby sister. She has been telling us, and so like she's telling us, "Mommy, I want our baby to grow up and grow up and grow up to be my best friend." So at the time, like when I did my first ultrasound, when I heard the baby's heartbeat, I felt so bad that she wasn't be able to there and my husband Ron wasn't there. So, like I knew that she would be so excited about to hear the heartbeat and everything, but because of the situation, like they cannot, like the doctor cannot allow them. So I
Oh,
really
so
appreciate that. Like they are trying their best so that like everyone stays healthy and they're trying to protect us from COVID-19. But it's a bit emotional. That's the thing. I hope like situation will be like better, and hopefully they hopefully like they'll be able to attend my other ultrasounds later on.
okay. So I do want to talk about this with Michelle and Nadia. You can feel free to jump in because I know when you were giving birth at that time of early March, there was a campaigning going on about mothers not giving delivery alone, having someone to be with them, a loved one, maybe one person. And there was a petition going on, and I myself signed for it, but I just find out yesterday, like in St. Joseph, it's not happening. So, Michelle, let us know because I know you also had wear another hat about policies.
Yeah, so it really depends on the hospital administration, and what their decisions are regarding visitors. So there's not a well, there is now an executive order from Governor Murphy that says every mother should have at least one visitor with them. But obviously, hospitals can choose to follow that or not. So I think the next part of that petition really needs to get hospitals who choose to go against the executive order to actually allow moms to have a visitor there. But the majority of hospitals are actually moving forward and allowing that one person.
Okay.
We're looking for, an expansion of that for maybe, again, to allow doulas possibly, or a second person like a mom. But the partner should be there, obviously, if mom wants that partner there. But again, the Governor Murphy has placed a executive order saying that no mother should birth alone at all. And so if there's a hospital out there that's actually doing that, then they really need to be outed in some way, or I think the state needs to know that they're not following that executive order.
And
Okay.
one thing I wanted to add to what Michelle said, Andrew Cuomo in New York State as well, also very early on, passed an executive order saying the same thing, that a woman should not be delivering alone. And, that's not something that just came from the top. There were activists and advocates and doulas such as Michelle and organizations on the ground that really pushed for these changes. And more specifically, Black women-led organizations, Black women-led doula groups, people of color-led groups that really petitioned and advocated on behalf of their communities to the governor. So I think it's really important to also give credit to the grassroots organizers, the women, the Black women, the women of color on the ground who've been doing this for years, who immediately stepped up and said, no, you need to make sure that the women we work with, the people giving birth, are respected, and that and there really is some kind of law and policy that respects their birthing process, to at least give them that one person, because as we know, birth is not just stressful. Things can arise health-wise, right? And also things like postpartum depression and the trauma and trauma that can happen during birth, preventable trauma that can happen during birth, both mental and physical trauma. So it's so important to not be isolated in that process. So I really wanted to acknowledge the work of these organizations who really made that possible, for these executive orders to even exist in the first place. I will say, Amber, that if anybody in the community has any barriers, whether it be language barriers, whether it be fear because of immigration status, to either reach out to you or to Gaudi or myself, if they're feeling like they're not being heard, because we know, Michelle and I know what rights there are there, but it's one thing to have an executive order. It's another thing of what's actually being enforced, right?
Absolutely.
On the ground, what's actually being experienced. So I know that I won't speak on for Michelle, but I will say for myself and Amber, please, if you are out there and you're hearing that somebody's rights are not being respected, to please reach out to us. We will advocate for you, because there is a law that's there. Now, if that's not being followed, or if for some reason a provider doesn't know or isn't following that, then we will be there to help you in any way we can.
Yeah, I'm really glad, Nadia, for you, and thank you personally bringing that up, because at the time of pregnancy, you're hormonal, and many people do not know exactly that what their rights are. At the same time, going through the emotions, and then when you're alone, when a person is alone, your decision power many a times, being pregnant mom, are not in the right state, and you cannot make right decisions. So that you're absolutely right. And language barrier is there. So thank you for that. I do have a question here, and the question
Randall,
is,
can I add something really quickly on
please,
that?
please,
Um,
please.
just from a minority perspective, having that discussion about birthing rights. And what we're seeing because of COVID and the pandemic is that we're seeing an uptick of higher instances of abuse in the hospital spaces. Um, Women who weren't being heard initially are totally not being heard now because they don't have that advocacy piece there in the room with them. If they're not having their partner, if they're not having their doula, no one's speaking for them. And, it speaks to one of the reasons why, Nadia, that, Black women were definitely one of the forefronts of getting a visitor with a mom, because we already know that our rates are terrible and abysmal compared to others. But obviously, other minorities are as well, have really, really poor numbers when it comes to what their options are. And the push and the move to interventions where you may not have wanted those things. And so I think that these are totally different times, and it's really putting a spotlight on the problems with maternal health, and we're not solving them. We're actually kind of going backwards a little bit when it comes to the women's rights and with regard to their race.
Speaking of race and rights, I think we all going all the way backwards with what's going on now. That's another topic to discuss, which is kind of sad as well. So the question was that how do you think that mental and emotional health could be implemented to new mothers during this pandemic, especially since many mothers go through postpartum depression? So I'll take Anita. Start with you. Anita, you're mute.
So prior to COVID, we already clearly had a shortage of mental health care in general across the country. So I can only guess that with COVID, it is only going to be worse in terms of availability. However, and I don't know the statistics of it, but with Zoom and telemedicine, those seem to be ways in which providers are reaching out to their patients. But yeah, it's needed now more than ever. I can only imagine, Nadia, what it was like to deliver during this time, right at the peak of the mortality and all of that. So even just entering a hospital can be really scary, just as it was to just go to the grocery store or anywhere, public places. So I can just imagine what it would be like to be a mother delivering at this time. But I agree with everyone on the panel, like, patient advocacy and the fact that you're hosting a program like this, and Michelle, that you're advocating for your patients. I mean, they really need you guys now more than ever. And I really appreciate all that you're going for.
Well, thank you, Dr. Anita. This brings another question and another scenario in our mind that, there are other options than going to the hospital. We can have childbirth at home, and as I was saying in the beginning of the show, that this process of giving birth has been going on for many, many, many years. And I do think that we should keep that in mind as a blessing in disguise. If, like Nina, you're, thank God, alhamdulillah, you're healthy and everything is going on. That should be another option to keep in mind, just in case, Michelle, enlighten us in that.
I have to unmute. Okay, here we go. Yeah, so you know what? If you are low risk, you have as many options as you want, right? So that means that you and your doctor or your midwife have had a conversation about your health and the baby's health, and all of that is given the green light. So that means you can birth wherever you want. And if you are choosing a home birth, if you're choosing a birth center birth, especially in this light right now, you get to have whomever you want with you and around you. Obviously there are more precautions when it comes to, birth center births. You're limited to maybe 2 or 3 people, but in the same vein, you're still supported and you're still given the time to labor and birth the way you want to. You're given the freedom of movement because what we're also seeing is because of COVID in hospital spaces, you are confined to your room. You are not allowed to leave. Your husband or your spouse is not allowed to leave that space at all for anything. So when you get into the hospital, that's it. You're going into your room and you're not leaving that room. So there's no more walking the halls to get labor to get moving. You're going to stay in your room. You're probably going to do circles in your room, and we can talk about how we can make movement a little more important with regard to getting labor to go a little bit faster. But for the most part, those freedoms that we were fighting for a long time to be in the hospital spaces are actually completely stripped now because of COVID. So, you're gonna find yourself much more confined to that bed space. You're gonna find yourself probably more so on the electrofield monitoring than before. So rethinking your birth plan is another um, thing to really start to talk about with your physician, and how your birth will change and how that plan will change because you're in the hospital space. So if you're really, really adamant about thinking about wanting a little more freedom with regard to your birth and actually trying it without medication, right? Because you're not going to have an epidural at home, and you're not going to have an epidural at the birth center. But you might be able to use some nitrous oxide at the birth center. So there are other comfort measures. Hire a doula. Absolutely, we are here to help you to get through labor and delivery in the most comforting ways as possible. But we're not just hand holders. We have tricks and all kinds of guides to get that baby, out in the most helpful ways. So I think it's really important to understand what your options are and really, really, really rethink where you're going to birth. Because even before COVID, and I just want to give a piece of information, even before COVID, low risk moms walking into a hospital space had a 29% chance of having cesarean. And that's just you walking into a hospital. That same low risk mother walking into a birth center space has a 6% chance of having a cesarean section. So understanding that iatrogenic measures sometimes get in the way, and adding interventions upon interventions becomes this little bit of a domino effect that actually kind of leads people to having what we call unnecessary cesareans. So again,
Absolutely, you're right. Because I think as soon as you step in the hospital, yeah, I don't want to talk bad about the hospitals. My husband works with the hospital and the whole family physicians, but that's the truth of the matter. You are trying the whole month training to be active, eating right, and walking. But as soon as you go in the hospital, what do? They tie you to on a bed and on a monitor. And so how is it going to help me in the labor? Because you're tired.
this moving speeds labor 28%. So if you're not able to move, then we already know that you're against the clock here. And if somebody's actually watching how long you're laboring and spending all of that time about looking at what your body's doing, every baby, every body is different. Everybody knows if you've had multiple babies, every single pregnancy was not the same. Every single labor was not exactly the same. So why do we expect, even in a larger amount of people, that every single labor is going to look the same? And attribute it to some kind of variable with regard to progression of labor. It's just unfair, right? So that's the problem with the hospital space. You want to be there if you're high risk because you're going to need those interventions. Absolutely, I'm not begrudging any of that. But we really have to look at the fact that if you don't need all that stuff, if you don't want all that stuff, then why you're there? Because pregnancy is not an illness. And once we remove that stigma from it, that's why it's in the hospital space, and that's why all of those two things are tied together. The minute you walk into that space, you're going to get an IV. Do you really need it? If you've been drinking every sip after your contractions, you're hydrated. But because we're walking into a hospital space, you're automatically going to be given an IV. But you should know you have right of refusal if that's something that you want as well. Eating and drinking. If you're not how long is labor for most people, right? Over 12 hours for a lot of folks, up to 72 hours for some. You think you're going to get through anything without eating? An IV is not food. So, you will hit that wall sometimes because you're not eating and drinking. So there's a lot of different things that people really don't know what their rights are, and they don't know the evidence behind some of those things as well. And there's a huge evidence gap between what we know from all Cochrane reviews and all kinds of good information and how it's actually applied to doctors and hospital spaces. It usually takes about 15 to 20 years for all of that information, that evidence to actually become practice. So you can have some physicians who were working on data that are 15 years old, right? So this is why they're telling you you can't eat or drink or you can't get up and move during your labor.
And if you think about it, why is so the scenario is set up in a way that why are we going to stop eating and drinking? Because what if we have to go through a surgery? And what if we have to put anesthesia in our body? So that's the mindset. So it's been prepared in a way. We have to be ready. What if we have to go for a surgery? Because if we are not empty stomach, we might throw up. And as soon as that anesthesiologist walks in the room, he doesn't even have to talk to us, but we're going to be built for him to just say hi.
You get a nice consult fee just for, hey, you want to talk about anesthesia?
Amber, I will say, as I was, because so many things were changing right when I was going to give birth, right? Like things were changing every single day. And I know, I also want to give credit to the hospitals too, because a lot of things were changing on their end as well. Like you, Amber, my sister is a physician. She's a resident right now. So things were just like every day things were changing for her too, as a physician in a hospital. And, I will say, as I was coming to my delivery date, I was kind of freaking out because I was thinking my first birth actually was, I actually had a really good experience with the hospital, but the birth itself was kind of traumatic in terms of, it was a 14-hour labor. In the end, I didn't have a C-section. Not, thank God that didn't happen. But I did have to have forceps were used, forceps for my birth because my son never turned. His head never turned to come out. So the recovery from that forceps birth took me a long time, and there was a lot of ongoing pain. So this time around, I was thinking, I had a good experience in that hospital, but my mother was there with me, and this time it would just be my husband, and I was calling back and forth to make sure my doula could come, but I was freaking out. I was thinking, well, I'm going to give birth in a week. Can I do a birth in a birth center? Is it too late? And I did reach out to some of my friends who are advocates and experts saying, could I go to a birth center? And they're like, you could, call and find out if you can do it, and you can let your doctor's office know. And I'm like, well, can I have an epidural? And they said, well, no, at a birth center, you can have but not an epidural. And for me personally, I have the worst pain threshold I know of any human being I've ever met. I stub my toe and I'm like down and out, right? So, and I knew that for when I first birthed, an epidural was something I like demanded. Like my doctor was like, you should walk around. I'm like, no, I want an epidural. And I think the important thing though is birth choice, right? Whether you want an epidural, you want a natural birth. I was low risk. I was over 35, so I had a bit of a risk because it was advanced gestational age or whatever. But other than that, I actually had no other risk factors. But I remember I came into the hospital and I went from, I think 3 centimeters to 8 centimeters in under an hour. So I was like contracting back to back to back. And I remember I was breathing through that. And even the hospital, like they couldn't give me the epidural as fast as I wanted. I was like, give it to me now. And I was trying to do the breathing exercises. I took a Lamaze class, but I think for me, I was getting very overwhelmed by pain, and I was trying not to panic, right, during that time. But I think what I'm just saying is that it's so important to just have choice. And for me, the epidural was the comfort measure I wanted. But I think that if I was better at the pain part, I probably would have had a natural birth. I would have loved to, because I was thinking, I'm like, why can't I have my mom and sister there? Why can't I have who I want at my birth? It's my birth, right? But if you're in a hospital setting, there's just going to be a different set of rules. And they're not bad rules necessarily. They're there for a reason. Also, at the time I had been already quarantined. I worked from home. So I wasn't leaving my house. And so we had no exposure to COVID. And my parents who were over 65 were at my house. So I did have a lot of fear about going in the hospital. People still didn't know what was happening with coronavirus. They didn't know, could babies get it? Could you pass it through breastfeeding? Which right now they found so far you can't. But there was just a lot of unanswered questions. And we knew almost nothing at that time. So thinking of going to a hospital while I had two elderly parents at home, I had a 5-year-old at home. They had just shut down school like at that week. So there was just so much unknown in the air. So I did have a lot of uncertainty and fear of going into a hospital setting, a building setting, or a home birth setting. But I think for me, in the end, I didn't want to change a birth plan too radically last minute for myself. And also the pain management part for me, knowing myself and how bad I am in pain management. I decided to stick with the hospital birth for myself. But I think, as Michelle's saying, knowledge is power, and having people that you trust in your village advocating for you, even if they cannot be there at the hospital, you can be on the phone even, right? My doula in the end was not allowed at my birth because the hospital wanted certain certifications, which they didn't before, right? And with my doula was there the whole time. She was there beginning to end. So my doula wasn't there at the time. And to tell you the truth, my labor was progressing so fast that I didn't even have time to it was just coming. The baby was like, I'm coming into the world. Luckily, it came with no complications.
You want it or not, I'm coming.
I didn't have a 12-hour labor. Like last time, he came in like 3 hours, 4 hours. So even today, when I change his diapers, I thank him. I'm like, thank you for coming in 4 hours, because I didn't have to labor too long. But it's like, even if, I think it's so important to be connected. And even if someone's on the phone with you, someone to talk to postpartum, there's a lot of help you can still get.
Yeah, I just don't want to discredit the hospitals and hospital care. I definitely cannot. I have to live with my husband, So, but I do have to recognize epidural, even if it's a drug, I was a different person after taking it. I took it 3 times, again, saying the pain. But I do want to bring that up because I had postpartum with both of I have 3 deliveries. So and each postpartum, it gets worse and worse. I think it's because as we are growing, and that's an extremely important thing to acknowledge. I don't have shame in acknowledging this, because this is how our people would know that we have to recognize, with my last delivery, I was actually on medication and I couldn't breastfeed my son, but it was extremely important. I have to be in the way for the safety of my kid. So again, that care was recognized in the hospital. Usually C-section is you discharge in 3 days. Now it's even within, I think normal delivery is a couple of hours and C-section is maybe 1 day. But due to my depression, they recognized it and they kept me for 6 days, which was extremely needed, and I'm very thankful for that time frame that they gave me. I know we talked a lot, Meena. I know you're pregnant, and there's so much information going in your head right now. So, what are you thinking? And now your scenarios. What do you think? Share with us.
Thanks, Amber. Yeah, it's really great to hear from everyone's experiences. Thanks, Nadia, for sharing her experience, and also Michelle talking about the alternative approach that we can take. So, based on my experience, so my daughter was born premature. So, and like that time, my water broke. That like it was my first time, and my parents were not here. So my husband and I was all alone. So we didn't have like much knowledge on that. Like I read too many articles on the internet. Also, and my OBGYN, the practice was really cooperative. So like I learned, but yeah. So when I went there, so I got admitted into the hospital, and yeah, I also took like epidural. Like Nadia, I waited for some hours, and but then like I said, oh okay, that's a lot, and then. And my doctor was so kind, and she was saying, "Oh, you have already tolerated a lot, so let's do epidural." So and I didn't have to do C-section, but yeah, but like you, like I couldn't breastfeed because Amaya was at NICU for 19 days, and when she came home, like I tried, but somehow it didn't work out. But she had to take baby formula. But Alhamdulillah, she's doing good. She's thriving, so I don't have any complaint on that. But yeah, so like
Awesome.
for this term also, like since like I have a really good relation with my OBGYN practice, so I'm going through them again because they know me, know my history, and I think I shared with you that I had hemoglobin E disease, like so my doctors knows everything, so I hope like will be taking care of me. So that's the thing.
Awesome. So right now it's too early for you to decide what's your choice or which way you're going. You have a lot of options to think about.
Mhm.
Next question we do have, what can um, Nadia, you want to take, or Anita?
Navigating yourself on body. Well, I think I don't think Michelle is like an expert. This is what she does. It's literally her job. But I will just say from my work, just with Moms Rising, especially the racial justice work, focusing on the disparities that women of color, but specifically Black women, face. It's I think again, knowledge is power, right? If and having there's these incredible organizations, like Michelle's, but also like Ancient Song Doula Services in New York City. There are there. I mean, if you even Googling a Black Mamas Matter Alliance, if anybody hasn't heard of them, you should definitely hear about them and look into them, and Google them and find out some of the resources they have. There are amazing resources just on the internet you can get for free. Black Mamas Matter Alliance has a lot of not just resources, but they have an incredible network of grassroots-based women of color, Black women-led organizations doing this work. And so much of advocacy is about not just is advocating for yourself, but also reaching out and connecting to these incredible advocates and activists who are doing this work all around the country in your local community. And I will say one other thing that we do have nowadays. Someone said, what if COVID had happened 15 years ago, right? With our brick Samsung phones, like how would we have communicated, right? Because we do have social media and the internet, and so you can even calls with doulas on a video or on your phone. There's access to information, even if someone can't always be with you in your own room. And I actually would love to pass this question to Michelle, because I just think she's a wealth of information on this.
Okay, thanks. I've got a couple of comments to make on that. Thank you for bringing up Black Mamas Matter. That's definitely an amazing resource. I think for me, the first piece with advocacy is education. So I would definitely get you into any kind of childbirth education course. Well, actually, let me rephrase that. Not any kind, right? I would say a very specific type of childbirth education course that speaks to evidence. And you can definitely go online to Evidence-Based Birth. It gives you a plethora of PDFs to print out that gives you really good information, really good concrete information about the studies and the research behind real evidence in birth. Some of the other advocacy pieces in understanding where your rights are, you can go to some very specific childbirth education platforms where you can find birthing right lists. They'll give you all of those tools with regard to that. In addition, I would always, I hear everybody talking about, oh, I couldn't manage the pain. And I get that. And I know that that's an issue specifically during a pandemic, because stress and your emotions and all of that stuff are going to be tied to your flight or flight situation and the pain, the way you handle pain. So remembering that pain management is not just physical, it's emotional and it's mental. And if you are not able to relax your mind and relax your emotions, you're not going to be able to relax from the pain. So I think really understanding, how your body works, and that's going to be in a class. what's physically going on with labor, period. What's happening during the different stages of your labor? What does it mean? And because, like Nadia said, knowledge is power. When I know that I'm feeling this way because my body and my baby is doing a certain thing, I'm not afraid of it. And if I'm not afraid of it, then I'm going to be able to work with my body as opposed to work against it. So there's a lot of different ways that you can really advocate for yourself. Is one, get that real good education about what's physically happening, because to be honest, a lot of women really don't know what's going on during their labors. And to really kind of understand what your rights are in whatever space you choose, whether or not that's a hospital, whether that's home, whether that's a birth center, whatever space you choose, you really need to know your rights in that space. And obviously, if you can, hire a doula. We do a good 50% of that work for you, right? So we kind of get all of that down. And if you can't, the other thing that I have going on right now is I've galvanized about 40 different doulas in the state of New Jersey, and we are offering right now free virtual doula services because of COVID. So at the end of this, I can give you the hotline number for that. But, this is really only for the use of women who have not already hired a doula, because we don't want to take that away from them. But this is definitely a free service that you can use and get somebody right on the phone during your labor, at the beginning of the pregnancy. At the beginning of the labor, if your water breaks, if it doesn't break, all that kind of stuff. Understanding what's happening. Just having somebody to talk to about those really oddball things, and letting you know that that's absolutely normal, reduces a lot of panic.
Yeah, it's a normal process. It's not a sickness. You're absolutely right, Michelle. Thank you for bringing up such an important point of fear, because it's such a mental thing. If you're gonna be scared, your body's not gonna work accordingly. There's a specific question for Dr. Anita. It is that what is the best advice for mothers having sick children during the pandemic, or due to younger kids born with diabetes?
Younger kids born with what?
With diabetic?
Oh, so that was a specific question for diabetes. Well, I'll answer first in general. It really kind of depends on what illness we're talking about, with whether the child is sick or the mother is sick. I think that's where testing is like the most important thing. But also, to answer JMLH's point about mothers needing support in the hospital while giving delivery or while delivering, and just hearing the story about how Nadia's mom couldn't be in the room, the sister couldn't be in the room, and even though they had been quarantined, I think in those cases that's where testing would have been enormously helpful. In other words, like if everyone is tested negative, they can all be together, and then that would have been a much more mentally happier and overall better experience. But for dealing with sick kids, it's really, I think, about separation. If you don't have access to testing, then I really do think the quarantining is like the only other way to go. I mean, you hear different stories. I mean, my sister-in-law, she's a hospitalist. She's in close contact with her elderly in-laws, in addition to a 3-year-old child. And she's dealing with patients, but when she comes home, she has to be careful. She's made the decision to sort of stay accessible to her daughter, which is completely fine. But I think you hear different stories. I mean, we're in uncharted territory, so I think that's one way of handling it. Her thoughts were that her children are not as seriously affected, so she was kind of willing to take that chance. But you hear the other extreme too, where doctors in Wuhan were in New York, weren't even going home to be with kids or their parents for fear of transmitting the disease. I mean, being an spreading the disease in an asymptomatic state is scary. Um,
Okay.
we're learning more and more as time goes on.
Yeah, absolutely right. Thank you, Dr. Anita. I know our time is coming to an end. We only have 4 minutes, so I just want to wrap it up and thank each and every one of you for coming in, giving this time of Saturday afternoon with us. And but again, the most important thing is that I do want to reiterate, childbirth is not a sickness. Yesterday, when I was with this mother and I spoke to her, she was almost in tears and she said, "Amar mein osusto," which in Bangla it means that my daughter is sick. So I could have just taken it as she said. So I said, "What happened with hospital?" I was just asking these questions because just to find out if that's a hospital that my husband can check up on her. I do give him homeworks. So she said St. Joe's and she's having childbirth. So I said that's not a disease. Apnar mein অসুস্থ নয়. She's not sick. That's a normal process of childbirth. Don't take it like that. So she said, no, it's fine, but the situation is different. We cannot enter due to COVID and things like, which is a concern for a mom. Um, but having said that, it's a beautiful, normal, natural process of life. And we have options. And as Nadia, you said, we are in one of the best timing technology. We're having this conversation because of technology. And people, the distances are becoming closer. I have another show in a couple of hours, and we are connecting people from internationally. So this social distancing is physically distancing, but it's mentally not distance. So it's a blessing in disguise with this time. But ask if you need help and recognize your emotional need. I'm giving you guys the floor for any last messages if you guys want to give. Nadia, you go ahead, and then
Sure.
we will take that 1-800 number from Michelle too.
Sure. And another thing is, if you after you have a baby, right, there's still a lot to do. I want to give credit so much to Michelle and another wonderful advocate and nurse in New Jersey, Nastasha Davis. And I actually, speaking of technology, there was a breastfeeding consultant in Missouri who's just like a colleague of mine. And all three of them, because of all three of them, I'm able to breastfeed because breastfeeding has been difficult for me until then. And all three of them, different times, being on video, answering my questions, coaching me through the process of breastfeeding. That's the reason I'm able to breastfeed today. I don't think I would have been able to do it, and they couldn't come to my house because of COVID, but they were able to do it over video. So I would just say, it is a challenging time. There's still a lot of unknowns. Places are opening, but there's still a lot of unknowns. So I think, trust yourself. I always tell every mom when they ask me for advice, I'm like, trust yourself. You are the expert on your experience and your body, and that is invaluable. So do follow your instinct. Do listen to yourself. And don't be afraid to reach out through technology. If there's a Facebook group of doulas that you like, reach out to them, message them, go on Google, use that information. Some of what Michelle provided, that group of doulas, that's incredible in New Jersey. So please don't be afraid to reach out, and also just trust yourself during this very difficult time.
Thank you. Mina, your last words?
So if anyone is pregnant like me during this difficult time, I would tell them, I would suggest them not to worry too much, because I know it's really a challenging time, and if we think and it will like add up our stress. So better whatever you like, try to do it. And if you're a religious person, you can practice religion. And also, if you like to read books, and you can watch shows. And also, like if you have your kid like toddlers, like I have a toddler, so my time never get monotonous because she always surprises me with things. So try to enjoy the time, and hopefully things will be better. Like I'm hoping for the best, but like around after September, maybe things will get better. So best of luck to
Yeah.
everyone.
Thank you, Mina, for your time. And Michelle, your hotline number, please.
Oh, okay. Can I send it later? I don't have it at this moment. But I can definitely give it to you guys later.
Um,
So the only thing that I wanted to just add is, on the postpartum side, if you've experienced something that you did not like during COVID because of your birth, give yourself and honor yourself and make sure that you help and find processes to center yourself because you were allowed to mourn the birth that you did not have, but definitely remember that it's still the birth of your baby and allow your body to just do its job. And that's it. But I will definitely get that hotline number for you guys. I wasn't
okay.
ready. I'm sorry.
No problem. Thank you. Dr. Anita, your last words?
Just a few basic things. So to help enhance a good pregnancy, I think diet, nutrition, whatever activity you're able to do, whether it's yoga or going for a walk, I mean, these things are really important and should help enhance the delivery process. And Mina, I wanted to wish you a very safe pregnancy and delivery, and I wish you all the best. And it was really great being able to participate with you all.
Okay. Thank you, everyone, for joining me. And I want to thank Channel 52 for, giving me this platform to bring such an important aspect of, womanhood, natural birth. And I do want to reiterate this, that, with this time that we are going through, at the same time, recognize your, small things that makes you happy. And at the same time, which makes you sad, recognize your body, recognize what makes you go through different emotions, because 9 months is a huge time, and the body is preparing for that main uh, thing which is going to be going on, the main show. So please take care of yourself. And like old grandmothers, nani, dadi, they have been doing this. That when somebody used to have childbirth, the girl used to go and live with the family for either 21 days or a month. That was for emotional support and taking care of them. That was, a cultural thing. So keep that in mind. Take care of yourself, and thank you again. And uh, please do take care of everything which is going around yourself and environment. And most importantly, we are mothers, we are sisters, we are daughters, we are caretakers of everybody else, but we forget about our own self. But we do need to take care of ourselves. So thank you again, and
I
Assalamu
have
alaikum.
the number.
Sure, go ahead. Give us the number.
973-440-9016.
Okay, so I'm just gonna type it here. It's 973
440-9016.
9016. So I'm just sending this, which is going to be recorded at the end.
Okay.
So thank you again, ladies. Have a
Thank
good
you
day.
for having me so much.
Thank you.